Hello everybody, and welcome to the Thursday edition of Video Clips. And today we're going to talk about how to lower your blood pressure without medication, which is easier than you think and actually more effective than drugs in some cases. So I'll just start with this. Overweight or obese middle-aged people are at higher risk for hypertension, and typically they're treated with drugs. But a better alternative might be diet and exercise, and I'll cite some studies about both and how they actually do lower hypertension. So a recent study showed that fast walking for just a half hour in the morning lowered blood pressure for men and women. And then for both groups, there was a little bit of an extra thing added on where the patients would get up and do a little 3-minute treadmill walking every so often. And that lowered blood pressure further for women. It didn't have the same effect in men. So the study design, they took 67 sedentary adults between 55 and 80 with an average BMI of 31. Their blood pressure was high, 37% had clinically diagnosed hypertension, and they were subjected to 3 different 8-hour test periods, which were, first of all, just sitting for 8 hours, which is a bad idea, not even just pertaining to hypertension. Sitting is a bad idea. 1 hour of sitting, and then 30 minutes of moderate intensity treadmill walking, and then 6.5 hours more of sitting. And I don't think that's such a good idea either. And then an hour of sitting, then 30 minutes of moderate intensity treadmill walking, and then 6.5 hours of sitting interrupted with 3 minutes of treadmill walking every 30 minutes. So just getting up and walking around. So first of all, notice that there's nothing really aggressive going on here. But the results were pretty good. And by the way, the meals were provided the night before, and breakfast and lunch each day, so that the food would not be part of the equation. They could just really measure the effects of the exercise. Well, the results of this limited amount of exercise were significant. Just the walking part resulted in a 3.4 point drop in systolic pressure and 0.8 point drop in diastolic pressure. And then for women, this didn't work for men, but the additional 3-minute bouts of exercise caused women to have lower systolic pressure, 5.1 points, 1 points lower, and 1.1 points lower in diastolic pressure. So an obvious weakness of the study is its sample size, only 67 people, but the significance is that this is an amount of physical activity you could actually get people to do. So we're not talking about people in their 60s learning how to run marathons and enter triathlons and go to the gym and lift weights, although I would really encourage that, but not necessary here. A pretty moderate amount of exercise actually making a significant difference, and it doesn't take up much time. Now, if you were to add dietary changes, you would see even better results, as you might imagine. Many studies show that in Western countries, blood pressure is lower in vegetarians than non-vegetarians, and also that vegetarians experience much slower and less blood pressure increase as they age. I mean, one of the things that I think is not considered enough when we're diagnosing and prescribing drugs in healthcare is the fact that as you age, your numbers change some. So people who are 65 and 70 and 80 are treated the same as people who are 20 in terms of defining normal, and that's not really a good idea. A meta-analysis that included 2 controlled trials with 311 participants and 32 observational studies with 21,604 participants showed that when people eating an omnivorous diet changed to a plant-based diet, their average systolic pressure dropped by 4.8 points and diastolic pressure by 2.2 points in the controlled trials. And then in the observational trials, the drop was even bigger. 6.9 points in systolic pressure and 4.7 points in diastolic blood pressure. Now, again, when we're looking at the effect of diet, being overweight is a risk factor for hypertension. Plant-based eating notoriously has a benefit in terms of weight status. Studies show that within the Seventh-day Adventist population, vegetarians have an average BMI 2.5 points lower than non-vegetarian Adventists. A meta-analysis that included 15 intervention trials reported that vegetarian diets that lasted 4 weeks or longer and without any calorie limitation, and that becomes important because most people really don't do well with really restricted calorie diets, but that resulted in an average weight loss of 3.4 kilograms. So weight loss is much easier when you make your diet up of calorie dilute foods. It's important to note, however, that even in the normal weight population, blood pressure is lower in people who eat a plant-based diet and even lower if you take it a step further in people who eat a vegan diet. So, and eating more plant food improves health outcomes for everybody regardless of their weight status, but one would argue that weight is a risk factor, so that we really should address that along with the issue we're talking about, which in this case is high blood pressure. In reference to salt restriction, it's promoted as one of the most important strategies for reducing blood pressure, but many studies don't confirm it. For example, a study of Seventh-day Adventists showed that Adventist vegetarians had lower blood pressure than omnivorous Adventists, but the urinary sodium measurement was the same between the two groups. And so I've written a lot about this salt issue and how much it's been misunderstood. And it may be really that the effect of a plant-based diet, and this was true in the DASH study, is the increased potassium intake. In other words, high sodium, really high sodium is bad, and a plant-based diet results in a reduction. But what happens when you start eating the plants is the potassium intake comes up. And that is most likely the primary factor in the DASH study, or dietary approaches to stop hypertension. Just 8 weeks of eating a diet higher in fruits, vegetables, and grains and lower fat intake resulted in a reduction in systolic pressure of 5.5 and a drop of 3.0 in diastolic pressure. According to data from the EPIC Oxford study, plant-based eaters, especially vegans, have lower blood pressure than meat eaters. And we see this again and again. It's a dose-dependent effect. The more plants you eat, the better things get, whether we're talking about blood pressure or any other marker you want to discuss. Some studies suggest that fiber may play a role in reducing blood pressure. The mechanisms of action include improved insulin sensitivity, improved endothelial function, increased nitric oxide production, and increased dietary and intestinal magnesium intake and absorption. Increased fiber intake, however, only makes a difference if you're consuming it in the food, because you don't get the same favorable effect from just taking fiber supplements separated from food on blood pressure as you do when you consume the fiber in the food. So the fiber is just one more constituent, like potassium, that has a positive effect on blood pressure. So I want to put the benefits of diet and lifestyle change in perspective by looking at what happens when people take drugs. All right. So if you take most of the drugs that are prescribed for hypertension, you get about an average 10-point drop in systolic pressure and 5-point drop in diastolic pressure. So if you were to adopt the mild exercise program I described at the beginning, and then the diet plan just used in the DASH study, it wasn't vegan, it wasn't extreme, just more fruits and vegetables and grains and lower fat, you'd end up with a 10.6-point drop in systolic pressure, 4.1 for diastolic pressure. And that's comparable to the effects of drugs without the side effects. Now, for example, the side effects, and this might be the real motivating thing to get people to pay more attention to the diet and exercise instead of drugs. Calcium channel blockers like amlodipine, that's one of the more commonly prescribed ones, do lower blood pressure, but they increase the risk of dying of cardiovascular disease and cancer, and increase the risk of both glaucoma and bleeding. Angiotensin receptor blockers like losartan also lower blood pressure, but they increase the risk of a heart attack. So, and we could go class by class, and we really don't need to do that here. It's just a general idea. The side effects of the drugs, and this is not just true of blood pressure drugs, are often the things you're trying to prevent by taking the drug. So do some people benefit from drugs to treat high blood pressure? Absolutely. Do most people benefit? Not so much. And one thing to consider, by the way, and we could almost do a whole separate video on this, is the smaller the abnormality, the less benefit you get from the drugs. So a person who has really high blood pressure, let's say 160 over 100, should be medicated, particularly until they get some weight off and use diet and hydration and exercise to change to lower their blood pressure that way. But if your blood pressure is 130 over 80, I think if you looked at the risks and benefits of taking the drug versus diet and lifestyle change, you could become really, really motivated to start exercising and change your diet in a meaningful way. So the better and best, I would say, and safest option for lowering blood pressure: eat better, exercise, make sure you're hydrated. And there are some side effects that I'll mention to you. Your cholesterol is going to come down, your fasting glucose will come down, you'll lose weight, you'll probably be in a better mood, and you'll lower the risk of a lot of other diseases, including cancer. All right, that's all for today. Hit the subscribe button if you're not a subscriber. And as usual, pass this on to anybody else who you think would enjoy watching it. And I'll be back to you next week with more news.